Rao, you say you don't charge anything. How then do you get funds to run the institution? Do corporates donate liberally?
You're right, Mr. Balram. Our entire service is based only on donations. Our current year's budget that we have for the year that has just started is 1.75 crores, and this is the amount of money that we need to raise for continuing our care. Like good corporate citizens, we also do our budgeting on a very, very professional manner. Our trustee treasurer is a chartered accountant, and she guides the trustees through the budgeting process. We agree on a particular budget, and this year, as I said, it's 1.75 crores. So we have to raise this amount of money every year, and we have started doing this in a very planned and organized manner. There are 2 or 3 types of donors who help us in our work. One is those families who are not very poor, who might be middle class, who are very happy with the way we looked after their loved ones towards the end of their lives. So that is one category of donor. It might be just 500 rupees that they might pay as a donation after the patient has passed away, once they are satisfied with our. So this is a very valuable donation to us, because it's not just the money part, but it's an acknowledgement that we have looked after the patient very well. So that's one category of donors. The second category of donors is those people who might have had a patient who died maybe 10 years ago, and in remembrance of that particular patient, they might send us a donation. That's the second class of donors. The third class of donors, which is really our mainstay, is the charitable trusts. Our biggest supporter from the beginning have been 2. One is, I told you that the Rotary Club joined us together. At a time when the project was just getting off, and when we needed to buy the equipment, when we needed to build the building, etc., the Rotary Club of Bangalore Indiranagar got us a very large grant from Rotary International, and with that grant we bought all our equipment. So that was the third category of donors. But the last category of donors, which is our real continuing help, I would say, is the Tata Trusts. You know, the House of Tatas is a very big entity, and much of their profits of each company goes into their own charitable trusts. They have 13 charitable trusts, and these charitable trusts support projects like ours. We have been supported by the Tata Trusts right from the beginning, and they come to us in a very professional way. They sit down with us, they sit down and examine our finances, they see how we spend our money, etc., and then they give us donations. The biggest advantage of getting trusts like the Tata Trusts to donate to us is it's not just a one-time donation. It's not just that they gave us a couple of lakhs of rupees and said, okay, we are happy with it. We also look forward to some long-term planning, because we have to plan how to make our money for the next year, 2 years, 3 years. The Tata Trusts give us money on a planned basis. After they are satisfied with our proposal, they come and examine the proposal together with us. Their own staff come, they are very qualified staff, and once they are satisfied, they commit themselves not to a one-time donation, but for the next 3 years or next 5 years. So we know exactly how much we are going to get in the next year, in year number 2, year number 3. So this has been our biggest support to, but what we value the most is that individual donation. That individual donation, it could be a very small donation, but that, as I said, is an acknowledgement that we have done something useful for it. And this is practically on a one-to-one basis, where we have looked after an individual patient, that individual patient's relatives give us some money. So these are the 4 categories of money we get.
Mr. Rao, what about the government? Does it help you?
Government has helped us a lot, Mr. Balram. Government has helped us by giving us 5 acres of land in a prime locality. Of course, when they gave us the land, it was not in a very prominent locality, but they have given it to us for a period of 30 years. That we pay a very nominal lease rent, and for 30 years the land is ours for the use of such patients. So that is the biggest help ever that anybody could give us, because today if you try and buy land, it is something prohibitively expensive, and for a charitable trust like that we could not. So that is the biggest help that the government of Karnataka has given us.
Yeah.
We have almost finished 15 or 16 years of that period. Another 15 years is to go. So that's the biggest help that we have received from government. The second type of help that we do receive is that our efforts are encouraged by them, in the sense to share my feelings on this. A few years ago, the then health minister apparently had heard about our work, and through some sources he sent word to us that I would like to come and see your work. He was a doctor himself, a politician. By that time he had become the health minister, and he and his wife came to see our work. It was not an official visit, it was not anything else, but he expressed his desire and we invited him to come. He came and saw the entire work that we were doing. He was extremely happy with us. He asked us close questions on how we raise our funds, what we do, etc. And he was, at the end of the visit, he was very, very happy. So when he was getting into his car, I went up to him and with folded hands, I said, "Thank you, sir, for coming. By your coming, you have encouraged our staff, and the staff are extremely happy that the health minister has come to see our work." Mr. Balram, that gentleman got down from the car when I said this, and instead of my folding my hands, he folded his hands and he said, "Now ಮಾಡೋದು ಕೆಲಸ ನೀವು ಮಾಡ್ತಾ ಇದ್ದೀರಿ. We should be thankful to you" anta. That I thought was the greatest encouragement we got. But beyond that, we don't trouble the government, because the government is already committed to so many other things, and we are able to get donations and we get the work. So the government has done this amount for us.
Mr. Rao, if a member of the public wants to help you financially or in kind, do you encourage that?
We welcome that, Mr. Balram, because being a charitable institution, all the trustees work on a voluntary basis. From the day I retired from my Madura Court's job, from then onwards I have been donating my time and my expertise to this sort of work. So anybody who wants to come and help us, we value that, because their own expertise can be put to use for a job like this. So we encourage that. Second thing is, if it's a donation, well and good, we accept that with great humility. The third is the expertise, that specific expertise that can be donated to us. To give you one or two instances of that, when we were just planning our facility, on a social basis, I met an architect, and she asked me what I am planning to do. ಈಗಲೇ ರಿಟೈರ್ ಆಗಿದೆಯಲ್ಲ, ಏನು ಮಾಡ್ತೀಯ ಈಗ ಅಂತ. And I said, I want to start a hospice. And she took a lot of interest. She was the owner of a firm of architects. She took a lot of interest in what I was saying. And at the end of the period, she said, "All right, we will plan your hospice for you." And I laughed and I said, "We cannot afford the fees of such a big architect's firm." And she said, straight away, without thinking, that my entire services are at your disposal free of charge. The entire architect's fee was saved by us. If you see the total project cost, at one shot we saved almost 25 lakhs, which we would have to pay to them. Now this is the sort of expertise that can be donated to us. Our advertising agency, all our designing, everything is done by an advertising agency. They do not charge us anything. So that's another type of expertise that people can donate to us.
Mr. Rao, are donations to Karunashraya exempt from income tax?
Yes, I am very proud to say, Mr. Balram, that our work has got us from the government two types of exemptions. One is exemption under section 80G of the Income Tax Act. 80G of the Income Tax Act entitles 50% of your donated amount to be deducted from your income for a donation made like this. But even more than that, we are recognized by the Government of India under a section called section 35AC of the Income Tax Act. Section 35AC of the Income Tax Act entitles the donor to deduct 100% of his donation from his income when he offers it up for tax. So if you are giving 100 rupees to us, then that 100 rupees can be straight away deducted from your income, and that becomes your income tax exemption. So these two exemptions that we've got, And many of our donors do make use of that. After all, they are donating their hard earned money. So, they are entitled to some sort of recognition by the government, and under section 35 AC and section 80G, these two donations really encourage donors to come to us and to donate.